Hello, Dr. Kerklaan. How are you today?
Good. How are you?
I'm doing great, thanks. Thank you for joining us. We're really excited to hear about your cannabis topicals. You have 20 years in practice, so we'd like to learn a little bit about your history and how did you start your medical career and how did you end up working with cannabis?
Yeah, for sure. I'm happy to share. It's really part of the journey, and it's my 20 years in practice is why we're here today. Because over the years, I've seen every pain under the sun, the whole gamut from musculoskeletal back pains and neck pains and whatnot, through to more severe sciatic situations. People are heading off to surgeries. So, over the there have been many questions about cannabis and how patients could use cannabis to impact their health. So that led me into doing some research and attending conferences, investigating. And it seemed quite clear to me that there's tremendous benefit for patients in this whole arena of cannabis for health. But yet there was very little in terms of product development and really like professionally developed products for the medical side of stuff. For sure, there's a big focus on recreational, but the medical side of stuff I felt was lacking. So I decided to take my clinical experience and apply it to our own products or product development, and as a result, developing the brand. So I was happy to put my name on it, really to give people the understanding that there is a professional behind this and there's a story as to why our products are here, and we're definitely here to help people.
Amazing. Well, I think we need more. I think we need more doctors like you to really dig deep and really unlock all these all the potential.
I think it's coming. It's coming.
All right, great. Okay, so your products generally feature a combination of THC and CBD, which are cannabinoids. Why do you use both of those elements together? How do they work together?
I find the science very fascinating, and the information that's coming out is really, really interesting. So, cannabinoids, they're complex. There are many of them. The plant is very complex, but the two main ones are THC and CBD. And I like to describe it in fairly simple terms that THC tends to be more of a painkiller and CBD tends to be more of an anti-inflammatory. So we therefore use those two components along with some other ingredients in order to achieve the effect that we're looking for, depending on the product that we've developed. So those ratios then come into play in the different categories that we're addressing.
Okay, I see. And how do you extract these compounds from the cannabis plant, and how are they infused into your creams? What other substances are in the creams?
So we're definitely, we have a medical focus, so we're very aware of the quality of the product and the consistency of the product. So we like to say we're triple lab tested. We have base formulations that are lab tested. We then have the active oil that is lab tested prior to us even utilizing it. And then the final product is lab tested as well to make sure the concentration is as it is stated. We're quite proud to put the concentration on the front of our products and on the front of our boxes. And we want to know that that concentration is in there. So the extraction process we're utilizing at the moment is CO2 extraction. And we're happy with the quality of the active ingredient that it gives us in order to then infuse into our base formulations to create the final products, the creams or the spray or the stick formulation that we have.
Okay, wow. Now, all of your products are also non-psychoactive. Is that correct?
That's correct. The first entry for us was really truly in the topical space. So our goal was to be non-psychoactive. We feel it's a great introductory product for people. So you can use it, in the office. You can be typing at your computer, put it on your wrists, whatever's sore, and you can use it without being concerned about entering into bloodstream and psychoactive effect. So what we do acknowledge is that our products have a certain range that we can help in. The really terribly acute chronic situation is something that people will need to seek psychoactive products for. So we do also have those under development as a second phase of what we're interested in bringing to market to help people. But primarily right now, we didn't add any carriers which would pull it through the skin and get it into the blood. So we're able to act locally without that psychoactive effect.
Oh, okay, I see. So I have here your skin cream. Now, this is a really cool product that helps with irritation, inflammation, and itch. But I know that it can do a little bit more than that. So I'm just curious, what types of uses are there for this, and what type of person would use the skin cream?
I'll preface that by saying we're in this very interesting situation where we have products underway in other countries. And so what we can state about the effectiveness of the product and some of the claims around it is different depending on the jurisdiction. So I do have to say that the FDA will point out that we can't claim to treat or cure any disease in this situation. But the skin cream, as you're using as an example, is an anti-inflammatory effect from the CBD within the product. So when you look at what can respond to an anti-inflammatory effect on the skin, it runs a very wide range. So we've seen it very effective on something as simple as bug bites. We're interested in almost doing a time-lapse photo of a bug bite because the irritation, the redness goes away very quickly. So you can go from simple, irritation on the skin through to more complex situations. We have had some people, hoping the skin cream would help a very, very complicated, intense situation, and that's not really what we're aiming for. We're aiming for the typical, contact dermatitis, irritation, possibly psoriasis, eczema on the list as well. But the situation there is really that this is a good anti-inflammatory. So anything where the skin is irritated and inflamed, there's potential to help with there.
Okay. What about hydration, moisturizing? Would this be good just something to apply in general to keep your skin healthy and looking fresh?
We've had great feedback from people using it as a daily moisturizer. We actually developed this cream. The base formulation is hypoallergenic, it's fragrance-free, it's moisturizing, and has a really nice feel to it. So in fact, you can use it, from aftershave cream all the way through to a sunburn cream and a night cream on your face. It's developed by biochemists in a lab who would be developing any other cream you might find on the shelf of a pharmacy. So we're very pleased with that formulation in particular for that product category.
Okay, excellent. And I can say that we've actually gotten some great reviews in that regard as well. So we also have here, I don't have your pain cream, but I do have the pain spray with me. Now this is this specifically geared for nerve pain or pain in general? How does it work overall? So
when you look at the response to receptors in what's called your endocannabinoid system, we can get into some complicated science, but your skin has receptors in it, and those receptors respond to THC, CBD, other cannabinoids. So in locking into those receptors, you're able to reduce inflammation, reduce pain response, reduce muscle spasticity or muscle tension. So we have those pain products there because if you look at what we suffer from as humans every day, those three items will cover many of the aches and pains that we have. So we see great response from muscle tension, people easing muscle tension, through to the more intense pain. But again, the range of a topical is within a zone, let's call it mild into moderate. If you get up into severe situations, you should either be consulting your doctor or looking for something psychoactive or going the traditional pharma type route.
So when you say looking for something more psychoactive, you're referring to still staying within the cannabis medicinal treatment?
Yes. Yeah. I really differentiate between non-psychoactive and psychoactive. So something that's going to get into your bloodstream and get to your brain, being a psychoactive product. So for sure, having THC in a psychoactive product to deal with more chronic pain, really intense acute pain, that's the route you have to go in that situation. But our products are great for the mild to moderate kind of everyday situation that most of us encounter sort of 80% of the time. And we did develop those three different products. The cream is a great one to apply. The stick has more of a massage type consistency, so you can really dig it in there and work it into muscles, massage at the same time. And then the spray was made as a quick drying, quick application, areas you can't reach, get it on your shoulders or use it on your wrists, your forearms. It dries quick, it smells great, and provides a really fast acting relief.
Okay, really amazing stuff. And I know that at ganjarunner we hear stories from our patients all the time using cannabis to slowly reduce their dependency on pain meds and opioids and things like that. And And I think that the pain spray is a great additive for just, some relief.
We're very happy to be working with you guys, and it takes partners to get the news out there, get the information out there, get people access to products like this. So
yeah, very cool. Okay, I have one more product here, the sleep cream. Now, this one I find particularly intriguing. We have heard some feedback that people find it very relaxing. Even just the scent helps them relax. So I'm just curious, how does applying something to the skin help assist with sleep and relaxation?
So the effect there is more along the lines of muscle tension release. So you're applying it around your shoulders, your temples, the base of the head, top of the neck, headache situations. You can even apply it to tight jaw if that's an area that's bothering you. So the concept is to simply get you more relaxed to be able to fall asleep. So it's a great, let's call it step one product for people who have some discomfort and some difficulty falling asleep. The categories there, I can give you a bit of insight, because sleep is a tremendous difficult situation for many, many people, right? It impacts so many people. So, and we know there's a great potential for cannabis to help sleep, particularly THC and then some other cannabinoids in there. So I wanted the category there because we know this is where we can add a psychoactive component to the situation. So we would call the sleep cream a primer for sleep, and then having a psychoactive, perhaps someone finds an edible or a tincture, something to have a deeper, longer lasting effect to help them sleep through the night. So the sleep category, I think, is tremendous. I think many, many people can get help for sleep through cannabinoids.
Oh, absolutely. That's what knocks me out every night. Okay. All right. Well, that's all the questions I have about your products. I'm just curious, what do you think the future holds for cannabis? What needs to happen for more doctors like you to come out, and how can we help reduce our opioid dependency with cannabis? What needs to happen there?
It's I tend to steer clear of any political comments, but ultimately I do believe for society and for patients at the end of the day, having access to this as a natural plant, as a low risk, non-invasive situation, I think really offers tremendous potential. And the catch-22, not being able to do any research on this to prove that it's effective, is an interesting one. So gaining access to research over time, I think, is one of the things that's going to change a lot of opinions. And I really believe that just public opinion and public interest at this point is definitely driving the needle towards more awareness, more acceptance, and more research. So I think the future is very bright, and hopefully there are things that fall into place relatively soon that really allow people access to this in a very beneficial and non-risk manner.
Absolutely. Well, Dr. K, I think you're a pioneer. We really appreciate you joining us today and telling us all about your products. This is really great information, so I can't wait to share this with our patients, and we look forward to catching up with you sometime in the future.
Yeah, it's my pleasure. You guys keep working hard, and we can help lots of people.
All right. Thank you, Dr. K. Have a great day.
Thanks for your time. Take care.
Bye-bye.
Bye.